Report any pain, burning, or sensations and any other discomforts that the patient would report to you. Maintain careful output records. Notify the nurse immediately if there is a decrease in urine output that is abnormal for this patient. Notify the nurse immediately if the urine appears to be dark, foul-smelling, or have sediment in the catheter tubing. Now please watch the demonstrations for the care of the patient with a urinary catheter.
Urinary catheter care. Begin by washing your hands. Gather needed supplies. Provide for privacy. Put on your gloves and elevate the bed to a comfortable working height. Cover the patient with a bath blanket while fan folding the top linens to the foot of the bed. Place the towel or bed protector under the buttocks. Position the patient on the back with legs separated and knees flexed. For the male patient, place soap and water on the washcloth. Hold the penis gently with one hand and washcloth with the other. Clean around the catheter at the tip of the penis first, turning the washcloth after each stroke. Retract the foreskin if uncircumcised and wash the area thoroughly. Don't forget to return the foreskin to proper position. Wash, rinse the catheter from the urethral opening down about 4 inches. Then you wash the shaft of the penis, followed by the scrotum. And then rinse. And then finally drying. For the female patient, place soap and water on a washcloth and separate the labia or the lips with one hand and use the other hand to control the washcloth. Wash and rinse the urethral opening, followed by washing and rinsing about 4 inches of the catheter. Cleanse one side of the labia, then the other, then the center, working from the front to the back and turning the washcloth after each stroke. Dry the entire area thoroughly. After providing catheter care, secure the catheter to the leg strap if it's being used. Check to be sure that the tubing is coiled on the bed and secured. Observe regarding any pain, pressure, or skin irritation or any other changes you might notice. Replace the bedding after removing the bath blanket and underpad. Dispose of supplies. Remove your gloves and wash your hands. When you return, lower the bed to its lowest position and adjust the side rails for safety if needed. Finally, wash your hands. Emptying the urinary drainage bag. Wash your hands and put on your gloves. Gather your needed supplies and explain the procedure to the patient. Remember to provide for privacy. Place the graduate on the paper towel under the drain spout. Do not kneel on the floor when doing this procedure. Remove the drainage bag from the bag cover. Remove the drain spout, being careful not to touch the tip of the spout itself, as germs can enter. Drain the urine into the graduate without letting the spout touch the sides of the graduate or anything else. Close the spout and wipe with an antiseptic wipe. Replace the spout in the holder on the bag. Replace the drainage bag back into the bag cover. Pick up the graduate and paper towel and dispose of the paper towel. Measure the urinary output at eye level on a flat surface. Observe for color and consistency and make a mental note of your findings. Discard of the urine in the toilet. Remove your gloves and wash your hands. Remove the privacy screen and lower the bed to its lowest position. Record the output and other findings on your notepad. Transfer the information to the intake and output record and report any unusual findings to the nurse.
There are patients who have a catheter for continuous drainage that are ambulatory, and they would find it very cumbersome to carry the tubing and the drainage bag. These patients will have what they call a leg bag drainage system. And this is a leg bag. This is the top of it. It will say top on the bag. And it has a drainage spout. It is applied to the thigh, and it has straps that are that you can wrap around the thigh. In order to apply the leg bag, you will need some equipment. You will have to have a sterile drainage cap and plug, and it will come in a sterile package. You will need to use a clamp to clamp the catheter to stop the urine from draining. And you will also need an alcohol wipe to wipe off the bag's top. I would like you to remember some points when applying the leg bag. It must be emptied more often because it is smaller than the drainage bag. Tension on the catheter tubing must be prevented. Care must be taken that the straps are not too tight around the leg. Leg bags are only used when patients are up. Remove them before returning to bed. Care must be taken not to introduce germs when opening the connections. Now I would like you to watch the demonstration of applying the leg bag.
Applying urinary drainage leg bag.